I'm a weekend warrior on the soccer field for one. That's probably my most activity. I do like trail runs, and I do a few of those a year if I have the opportunity. My first ACL tear probably 12 to 14 years ago, and it was a soccer game. And I actually waited a year before I did the surgery. A friend of my wife that she worked with had done surgery. She had surgery on one of her knees, and she said, "Go see Dr. Shelbourne, he's the best." And when I went in to see Dr. Shelbourne, he said, I said, "What can I do after surgery?" He said, "What do you want to do?" So I want to play soccer again. He goes, "Well, then we're going to let you play soccer again." His surgery worked. It was great. My recovery was great. I was playing back from that ACL tear in 6 months. My second ACL tear was about a year later. And of course, I went right back to Shelbourne for that surgery. My total joint replacement was a situation where last March, I started having some pain. It was a different pain than what I'd normally experienced from either running or walking or whatever. I wasn't real active because of the pain after the activity. It was too intense, so I did the icing therapy and a few things, but come June, it wasn't going away, so I went and visited Dr. Benner and we talked, and he showed me the x-rays, and both my knees were showing breakdowns and bone on bone. My right was my worst one, and he said, "You need a knee replacement." My body was telling me that, and I wasn't accepting it, and along about August, I went back to Dr. Benner and I said, at the Shelbourne group, and I said, "What do I have to do?" So we scheduled a knee replacement, and we did it January 8th of 2017. What I liked about the Shelbourne group is they actually give you a booklet that will show you first week, here's your second week, here's your expectations. They look at you and what your capabilities are going before surgery. He said, "I need you to be at this point on your extension and flex. I want you to try to manage your inflammation. I'm going to set you up with the therapist." And the whole thing there was, it was daily activity. I would have to do some stretching daily, at least 3 times a day. And I went into surgery, and the regimen just continued. It was a little more intense after surgery. That's probably why I think my recovery is going, is because of what they did up front. And my experience at Community East was great. So I don't know if it's just the effort that they put out, and then of course the Shelbourne group, and then the post-surgery. My left knee will happen, and I will choose the Shelbourne group again. Just for the fact is that the expectations I've already explained about the recovery on ACLs plus this knee, I don't see any reason to switch. The biggest thing is I'm walking pain-free.